Dementia, when the brain begins to lose access. First, understand what you're observing. Dementia is not one disease. It is a description of declining cognitive function, memory, reasoning, language, judgment, orientation, or the ability to navigate ordinary life. Do not immediately conclude the brain is permanently gone. First ask, what is interfering with its ability to function? Because different causes require very different responses, examine the physical system. The human brain is extraordinarily dependent upon its biological environment. When that environment changes, cognition can change. Examine blood flow. Strokes and damaged blood vessels can progressively deprive brain tissue of what it requires, proteins. Alzheimer's disease involves abnormal processes associated with amyloid and tau, nutrients. Vitamin B12 and other deficiencies can sometimes imitate cognitive deterioration. Hormones. Thyroid dysfunction can affect memory and thinking. Medication. Some drugs and combinations of drugs can create significant confusion, particularly in older humans. Sleep. Untreated sleep apnea repeatedly interrupts oxygenation and restorative sleep. Alcohol and substances. Depression, infection and acute illness. Hearing and sensory loss, and occasionally abnormal accumulation of fluid around the brain, as occurs with normal pressure hydrocephalus, a condition that can sometimes be treated. Therefore, before declaring this human has irreversible dementia, investigate. Can it be reversed? Sometimes, but precision matters. If cognitive impairment is being produced or worsened by something treatable, B12 deficiency, thyroid disease, medication effects, depression, sleep apnea, alcohol, infection, or another underlying condition, treating that condition can sometimes produce substantial improvement. But established Alzheimer's disease, Lewy body dementia and frontotemporal dementia currently have no proven treatment that completely reverses the underlying neurodegeneration. Do not allow hope to become misinformation. There are treatments that may manage symptoms, preserve function, and in certain Alzheimer's patients, slow progression. Slowing is not reversing. Know the difference. Do not merely treat the label. Investigate the system supporting the brain. Ask, is sufficient oxygen reaching it? Is vascular health being protected? Is sleep restorative? Are medications impairing cognition? Are nutrients adequate? Is hearing loss isolating the brain from stimulation? Is the body moving? Is the human socially engaged? Is depression present? Have thyroid and B12 been checked? Has appropriate brain imaging been performed? Then support what remains healthy: movement, cardiovascular health, mental stimulation, social connection, adequate nutrition, treatment of hypertension, diabetes and other vascular risks. These are not magical cures. They are ways of creating the healthiest biological environment available to the brain. And remember something important. Memory loss does not erase the human. A person may lose access to names, dates, places, stories, eventually perhaps even familiar identities, but do not begin treating them as though they have already disappeared. Speak to them, touch them, play familiar music, bring familiar photographs, allow sunlight and movement when appropriate. Preserve routine, preserve dignity, preserve connection. Because the deepest question is not merely, how do we recover the memory? It is also, how much function can we protect, what treatable causes can we remove, and how completely can we continue meeting this human where they are? That is where medicine and compassion meet.